A few weeks ago, my grandpa came up with a hypothetical that he was asking everyone in my family. If we were sick and needed an expert's opinion on what treatment to get, would we rather see a brand new doctor, fresh out of med school, or an older doctor with years of experience? Now, think about what your answer would be. And since a lot of you are pretty ingrained in the medical field, you can probably make an informed decision on this. But my grandpa's answer was to go see the young new physician. I think he thought that this would be the surprise answer and wanted the shock factor, but his reasoning made sense. He wanted to talk to the person who was most recently in medical school and who he thought was probably the most up to date with recent treatments and evidence. So I introduced him to a concept I'd come across here and my work as an intern: clinical practice guidelines. Clinical practice guidelines are evidence-based medical standards. They're developed by researchers and committees to guide physicians in their decision-making. You can think of them as instruction manuals. This concept seemed pretty similar to what my grandpa was trying to get at. Patients like to know that their physicians are using evidence-based treatments on them. My research was looking at these guidelines for a different purpose, though. Could clinical practice guidelines be used to reduce racial health disparities? Experts seem to think yes. Currently, Black Americans consistently receive older, cheaper, and less intense treatment than clinically identical white patients. Some of this can be attributed to differences in hospital quality between segregated neighborhoods, but a large portion of this disparity is caused by physician implicit bias. Currently, there is no legal mechanism for litigating against discriminatory care unless there is a clear intent to discriminate. So this means that a physician that makes decisions to give less intense care to their Black patients based on their implicit biases can't be held accountable without that intent to discriminate. However, if the medical community adopts a set of clinical practice guidelines as a legal standard of care, these actions could be litigated against and hopefully prevented in the first place. There are a lot of decisions that would have to be made for this to happen. Who would make the guidelines? How would they be tracked? How much room is left for physician discretion? But the benefits outweigh the costs. Physicians would have a clearer idea of the correct route of care, speedier medical malpractice trials would save significant money, and racial health disparities would reduce. Right now, there's a lot of focus on social determinants of health and how your environment influences your health before you even get to the doctor's office. However, for as long as bias has a role in the doctor's office, the medical community needs to make strides to address it, and clinical practice guidelines are an option. Thank you.